Hey guys, it's the Strength Karo here with you today. So we're going to talk about knee pain just a little bit, and then we're going to get into some of the best exercises, literally only 2 good exercises that we can do almost immediately to start decreasing pain and start improving function of the knee itself. Now, knee pain, okay guys, so there is so many conditions that can cause a knee pain. To name a few, you can have a knee tendinopathy, we can have a patellofemoral pain syndrome, we can have a ligamentous related pain injury caused by PCL, ACL, LCL, MCL, along with all the grades, grade 1, 2, 3 of all those. We can have a meniscus tear, we can have even arthritis of our knees, okay? And arthritis, obviously, that affects more of the older population, but that is quite a debilitating condition for many, many people. Now, there are 3 things, okay? I'm gonna sum everything up. There are 3 things we need in the early treatment of knee pain, okay? The first one is to decrease pain, all right? And through the use of isometrics, I believe isometrics are one of the best ways for us to decrease pain, okay, and to get immediate results. The second way, guys, the second way that, the second thing that we need as well is going to be to improve the mobility or movement of the knee itself, okay? And the third one, which no one really talks about, is going to be more of a mindset change, okay? We need to educate that patient on the role of pain and that pain really doesn't mean a whole lot. Yes, you may have some degeneration, but that's a normal part of aging, guys. That's a normal part of aging. And many findings that you'll find on MRI or X-ray are quite incidental. So there is still plenty that we can do with what we have left to improve the function and capacity of the knee itself. So let's get into the first exercise. This is going to be a one-take video. So the first exercise is going to be a wall sit. Now, wall sit, you say, like the Strength Karo, that doesn't do anything. You know, that's just an isometric. Well, that's true. But isometrics are an absolute great way to start strengthening all the muscles of the knee, okay? And to start loading them in a closed chain fashion to get the fastest progression of exercise that we can possibly get, okay? And we can be very specific with the targeting of certain angles and muscles and joints as well with a wall sit. So let me demonstrate. A wall sit simply is back against the wall, feet out in front a little bit. We're gonna come down to a sitting position and we're gonna hold this for about 1 minute, okay? And yeah, you might be thinking, that's not too hard. That's not too hard at all. But guys, we can target, like I said, different angles. So say we have an athlete, they get knee pain because they have patellofemoral pain syndrome or they have a tendinopathy of the knee. So this position, guys, say they're a squatter, all right, a powerlifter or Olympic weightlifter, possibly if they go beyond 90, that might be an aggravating position for them. But if we go just above 90 degrees at this angle here, that might be a great position. And then we can start to load up that specific position, okay, in a way that's not going to be harmful, okay? So that we can start to do that. I'd probably recommend for someone along those lines, an athlete, strength athlete, probably 1 minute and about 3 to 5 sets most days of the week, even 5 to 7 days of the week, and holding that position. All right, now, how can we modify that, the wall sit for other people, okay? Say we have an elderly person, they have arthritis in their knees. The wall sit is a perfectly good exercise for them as well, but we're gonna modify a few things. The first thing we're gonna do is not to have such a big angle of the knee. So maybe we'll just get them standing up first, coming down really, really, really slowly, and maybe this is the only position they can tolerate. But say they go lower than that, they can feel that pain in that knee come on, but they can tolerate this position, that's perfectly fine. We can get them to hold that for 1 minute as well. And if it's too painful, I'd even get them to do about 30 seconds. It really depends on the person I'm seeing. So 30 seconds, we can do 4 sets of that, and we'll do that 2 to 3 times a week, okay? And one of the cool things with wall sits, guys, as well, is that we can actually utilize external cueing, okay, to get a better stimulus of that isometric. So what do I mean by external cueing? So let's go back to that second example of the older person who has that knee pain. We can get them to go in that position, okay? And then we can tell them, I want you to focus on pushing through your heel. And then they go in that position, they can push through their heel. That actually creates a lot of stimulus through those quads, even more so than if I'm just kind of relaxing and chilling out here. So telling that person to actually utilize that external cue in their brain to push through their heel is going to help as well. And we can do that for any type of person, okay, to get more bang for buck for those exercises, okay? The next exercise is going to be something very, very simple as well. And that's going to be a terminal knee extension. I'm just going to go down here. So if you've been to physio school or you've looked on the internet, you've seen the prehab guys, you've seen Dr. Jake Harden, you've seen Vinny Rehab, you probably know what a terminal knee extension is good for. So terminal knee extensions, guys, allows us to get the end range of the knee joint. And why this is so important is because we need to access full range of the knee to start to strengthen it in all its capacity, okay? And when I say capacity, that's basically the ability for it to tolerate, different activities, okay? Such as going upstairs or going downstairs or stepping out from the car. We just need it to tolerate more of those activities that require more from our knees, okay? So all you need is a pillow. You don't need any fancy bands or Bosu balls or anything like that. We're going to fold it up like this. Now, placing it behind our knee, and this is obviously the painful knee, or we can do it on both if we have. One foot's going to be forward on the ground, and I'm going to tilt the camera so you guys can see a little bit better. Like I said, roll it up, place it behind the knee, one foot just in front a little bit, and from this position, all we're going to do is force our knee to extend against that pillow. There we go. And we're just going to do that really slowly. So from that position, again, letting that knee get a little bit lax, just a little bit of an angle there, and then pushing that knee against that towel or pillow, in my case, and really holding that position. So doing that a few times, actually, guys. We're going to do 8 to 10 reps from that position as well. Just like that, okay? Guys, I'd probably recommend to do that 8 to 10 reps, like I said, about 3 to 4 sets as well. And this is an absolute great exercise, and it's necessary when we have knee pain to reach that terminal knee extension. Now, there's plenty different ways that we can even regress that exercise in particular. We can go on a lying down face up position, put the pillow behind our knee or a towel, and I definitely recommend regressing the load with that exercise if you do have severe pain, such that you have maybe arthritis or something like that, or maybe your post-op ACL or something. We can always regress it. Okay, guys, so really those are the 2 exercises, and obviously the mindset's quite important, but hopefully you all got a lot from that video. I really enjoy making these videos, and I hope to see you really, really soon. This is Strength Karo signing out. Bye.